Good afternoon, everyone. Hi, this is Dr. Paul Zeitz coming to you live from Bethesda, Maryland. It is Wednesday, April 7th or 8th. I can't remember what day it is. And I'm here today with my live chat on the COVID-19 pandemic. If you're anything like me, you're overwhelmed by this state of the epidemic, this extended shelter-in-home order that we're living under, and the fire hose of information that's pouring in, and the amount of misinformation and fake news that is also pouring in as well. As an experienced epidemiologist working on infectious diseases like AIDS, TB, malaria, and the hantavirus, meningococcal outbreaks earlier in my career, I've taken it upon myself to diligently track the epidemic and the response here in the United States and globally as we all are trying to handle this COVID-19 pandemic. I'm here today to share my perspectives on the most up-to-date information and also to share some of the optimistic information about progress that's being made to combat the epidemic here at home and around the world. So welcome, Karen. Thanks for joining. It's great to have you again from California. So we have folks from California on the line and Maryland so far. And I'm trying to pull up the live feed here on my Facebook page so I can see the questions that hopefully will be pouring in live. Oh, here we go. So I'm going to start off with, here we go. Takes me a second to pick it up live. Okay, great. Hey, Pennsylvania's on the line. Hi, Donna. Thanks for joining the call. So I'm going to start today with a few updates about the epidemic, and then I'll be moving as quickly as possible to your questions. The pandemic continues to rage in the United States and around the world. We're still on the global upswing, and I think we're still on the upswing here in the United States. Globally, as of today, there's about 1.5 million cases from countries around the world, with 87,000 deaths reported so far. Here in the United States, over 400,000 cases, or approximately 400,000 cases, have been reported, and over 13,000 deaths. 780 people died just in the last day in New York City, and that's been a record high as well as yesterday. So the epidemic is really intense in New York City and the surrounding areas, particularly North Jersey. There's also increasing concern of hotspots in the Baltimore, D.C. corridor, where the number of cases is increasing. And also there are urban areas and rural areas across the United States where we're seeing an upswing of cases. Hi, everyone that's joining. Thanks, Jean and Dawn from Georgia and other Maryland folks. Hi, Rena. Thanks for joining the call. If you could say where you're listening in from, that would be great, so that everyone knows who's on the line. So I think that as we knew, this week was going to be very difficult and very challenging, and we're seeing a lot of concerning stories and reports around the country about how the epidemic is unfolding. We're also seeing some good news, I would say, or encouraging news, where the shelter-in-home orders seem to be having an impact. In the places of the country that were first to implement the shelter-in-home orders, in Northern California, for example, it looks like the peak has been flattening the curve. So the number of new infections and the number of hospitalizations has sort of leveled off, or is a lower curve. And that is an exciting kind of demonstration of the power of the shelter-in-home orders. It's sort of the Northern California zone seems to be matching the kind of trend lines that we saw in places like Singapore that intervened early and took appropriate bold action. Welcome everyone who's joining the call. Please identify, if you could, in the chat where you're calling in from. That would be really great. Welcome Kathy from California and Lacey from Maryland. It's great to have you here today. We're just going over some of the updates about the epidemic. As many of us know, we're entering into the kind of spring holiday seasons. We have Passover that's starting tonight. We have Easter Sunday on this upcoming Sunday, and Ramadan starts on April 23rd and goes until May 23rd. So all of these holidays are happening during the COVID-19 pandemic. So my colleagues and I worked on a policy brief last weekend, and that got published on Sunday, and then we issued a press release on Monday raising the concern that we have about religious gatherings that are still being held in all of these faith groups in the United States and around the world. We only have 42 states that have shelter-in-home orders right now, so there are still 8 states that are not implementing social distancing with restrictions, and there's about more than 20 states, I think it was 23 states the last I counted, that have loopholes or exemptions for religious gatherings. Myself and many public health experts are really concerned that these religious gatherings over the next month, where people will be interacting in direct contact with each other, could lead to a spike in new infections and a spike in deaths. So we're calling on the president to implement a national stay-at-home order. We're calling on governors around the country, especially in those 23 states, to intensify their orders to restrict religious gatherings and social gatherings during this holiday season. And finally, we're calling on faith leaders from all faiths, Muslim, Christian, and Jewish, and Hindu, and Buddhist, and every faith, to do virtual prayer, do virtual gathering, to bring your community together, because everyone is yearning and craving connection, and to do that virtually rather than having in-person religious gatherings. We've heard report after report of religious gatherings in the Jewish Orthodox communities, attending funerals of rabbis, where a rabbi in Brooklyn had died of COVID, and then a massive funeral was held. The police actually had to intervene. And it's this kind of thing where the idea of saving lives should be the highest priority. And that means that we have to sacrifice. Passover, for example, is my favorite holiday, and I won't be able to be with my family tonight in person, but we're having a Zoom call with one part of our family tonight and a Zoom call with the other part of our family tomorrow night. So I think that it's a sacrifice. And the reason why we're doing the social distancing and why we're making these choices to do sheltering in home, and we've heard pleas from our public health officials for this week and next week to intensify and strengthen our social distancing. As the virus is spreading rapidly at this time, any reduction in social distancing that you can have, even reducing your shopping and your trips to the pharmacy, any of that is requested to be reduced during this time because the virus is spreading rapidly here in the United States. So welcome everyone who's joined the call. I see we have people from different states. If you could just say hi and let us know where you're calling in from or listening in from, that would be really great. I see we have Mulenga from Zambia. We have Spencer from Texas. We have Hope from South Carolina. And we have folks dialing in from Maryland and Pennsylvania and other parts of the world and country. Welcome, Rosemary. Thanks for joining. I know you're calling in from Virginia, or listening in from Virginia, so welcome to the call. So I think that, thank you all for joining today, and please start putting your questions into the chat. I'm about ready to transition to taking your questions. I did just give an update on the state of the pandemic here in the United States, and a couple other new developments that I'll go over quickly. Last Friday, the Centers for Disease Control and Prevention is recommending that when you go into the public, that you use a mask, that you cover your face while you're going into public. And now we know that the Los Angeles area, Mayor Garcetti, yesterday implemented a requirement that facial masks have to be used in all public settings, including by workers that are working at restaurants, pharmacies, and grocery stores. So I think, as predicted, as the epidemic continues to show itself, and as the number of infections go up, and as the death rates go up, we're going to see more and more restrictions and more guidelines coming out as we're learning more about how this virus is transmitted. So, as you know, there are different kinds of masks out there. There are the N95 masks. I have one just to show you. These are urgently needed by our health workers and our frontline workers. So it's not recommended that these masks are used when you go out in public. There are surgical masks like this that are also in short supply for many of our health workers, although in this area here in Maryland, I have seen a lot of people in the public using these kind of surgical masks. The other kind of mask is the homemade mask and the cloth masks. You can use bandanas or other scarves or cloth masks. It is recommended. A cloth mask like this has 3 layers, and you can insert coffee filters or other devices inside of these masks and wear them like this and put them around your face, making sure you're covering your nose and your mouth. Making sure you're covering your nose and your mouth. I think the masks are really important for several reasons. One, you can, if you are an asymptomatic carrier, you can stop transmitting the virus to other people. It also may reduce your ability to get infected if someone around you has it. What I've noticed for myself is that when I'm wearing a mask, I'm more attuned to the social distancing, and other people also walk away from me. Maybe they think I'm infected or something. But I think by having the mask, it's more, I see that social distancing is happening more rigorously. And the social distancing and the sheltering in home is being done for 3 main reasons. One, to protect yourself from getting infected and your family members. The second main reason is that you're reducing person-to-person transmission in the community, and you're helping protect your neighbors and your community members who may be vulnerable to severe illness. And the third reason is that by reducing community transmission at this critical time, you're going to be reducing the number of people that get very sick and that have to go into the hospital. And so, as we already are seeing in New York and North Jersey, the hospitals are getting overwhelmed. They're running out of personal protective equipment. They're tight and short supplied on the ventilators. And so as these hotspots start peaking, you can see in real time why the social distancing and the sheltering in home is so important to reduce the burden on our healthcare systems. So welcome everyone. Thanks for joining the call today. We have a larger crowd today. And please let us know where you're calling in from. And that would be really helpful to say where you're listening in from. So we have folks from Maryland, and I'm going to have to keep a list here. I'm losing track. California, Virginia, Zambia, Texas, Pennsylvania. Please let me know. I'm sure I'm not keeping track on all this carefully as I'm trying to keep my mind straight on answering your questions and giving you some early updates. The other news that happened yesterday that I just wanted to share is the progress that the governor of California reported on TV last night, where the state of California has worked with a consortium of nonprofits to develop a procurement arrangement to import millions of masks, both the N95 and the surgical masks, each and every month that will meet the demands of the state of California, and also they'll be able to export those supplies to other neighboring and needy states. We've also seen California, who's going to peak a little bit later, share their ventilator supply with other parts of the country. This kind of sharing and empathy and collaboration and innovation is exciting to see in a response to the challenges that all the governors are facing. The federal government has not implemented a national coordinated procurement strategy for ventilators or personal protective equipment, and so that's left it up to the governors to figure it out on their own. And it's great to see bipartisan collaboration between Democratic and Republican governors, and sharing of innovation and sharing of commodities that are critically needed at this critical time. So I think there's some positive developments from those leaders at this time. Okay, so I'm going to start responding to your questions. And I wanted to start, if my support team could text them to me. There's so many comments coming into the chat, and I'm having a hard time scrolling up while I'm on camera here. Okay, so question from Pennsylvania from Dr. Donna. She asks, what do you think is a realistic time frame for ending the shelter in home? I am worried people think we'll be fine by May 1st. Thanks, Donna, for your question. We've been talking about this kind of question since I started the live chats a couple weeks ago. As you know, the federal government has recommended strongly that there will be shelter-in-home orders in place through the end of April. And I think that we're going to have to see how that goes. But it's very likely, in my opinion, that that will be extended into May, if not through the whole month of May. We're seeing that the epidemics are starting to intensify, and we are hoping that they will peak and then start to flatten down. There are models that are out there from different sources, and the models are not agreeing right now. It's sort of like the weather models. You know how you go onto the weather and they're predicting this or that, and then it changes as the data gets clarified, and then sometimes the models aren't right. And sometimes we get a bigger storm, and sometimes we get nothing. Well, I can say for sure that we're not getting nothing. We're having a massive pandemic here in the United States from COVID-19, where we already have nearly over 13,000 people that have died in a very short period of time. The models are flipping around right now. We could have peaking in April in many places, but it will be geographically different. So, for example, New York City and North Jersey are peaking now, and Maryland isn't supposed to peak until later in April. And different parts of the country, we're just seeing the rapid increase in number of new cases, so they're still peaking. They're still on the upswing. So we're going to see a lot of variation in when the epidemic is peaking. And so I think it's hard to predict exactly how long shelter-in-home orders are going to be in place. The other variable that we have to track very carefully on the shelter-in-home orders is the testing system. So as we know, testing is now more available than it had been a month ago, but it's still hard to get tested in some places in the country. So in places where there are hot zones or hot spots, the testing is being limited for healthcare workers and for people that are in hospital settings. And so the people in the community that may be showing signs and symptoms of COVID-19, many of them are still not getting tested. So I think there are new tests that have been approved by the FDA and that are being rolled out nationally that are the rapid point-of-care tests. But those systems are not up and running yet. And so I think there's a lot of work going on to try to expand the rapid testing to determine infection. And until we have that up, we won't really know what's happening with the transmission at the community level. The idea is that we get through this first wave And by the end of this first wave, which I hope would be wrapping up by the end of May, then we can have a testing system up and running by then so that we can identify new cases that are occurring, and we can go back into a containment approach where we identify cases quickly, we do contact tracing, we isolate those cases quickly, and we limit or eliminate community transmission. We missed the window on that on this first wave, and we're seeing community transmission happening across the country. And so we're hoping, and I'm hoping, that we can make progress on the Test the People campaign, where we can get a testing system up and running. I've seen great proposals coming out of academic and thought leaders, public health experts working on a national surveillance system. I've heard progress being made within the government about establishing this kind of system. So I think the planning is underway. The ideas about how to do that are being developed. There hopefully will be another legislative package going through the Congress where a national surveillance system can be established and funded by Congress. And I hope that that will happen during the week of April 20th when Congress returns to session. And so hope the progress on designing and implementing that can happen relatively quickly. We can build that national surveillance system off of the influenza surveillance system. We have the testing, rapid testing tests that are now available and up and running. They just need to be set up around the country. So I think we've made some progress. It's not set up and working perfectly today, but over the next 6 to 8 weeks, I can see that that could be happening and that we could have a national surveillance system. So as this first wave declines, hopefully by the end of May, then if we have a national surveillance or testing system up and running, then we could switch into a containment strategy from where we can identify cases quickly, isolate them, do contact tracing, isolate any positives, and then contain the spread of the virus in the second wave. The other part of that is antibody testing. And there is a huge amount of work going on to develop new antibody tests so that people that have been infected already, that may already have antibodies to the virus, we could know that, they can know that, and then they could be available to return to work or to be returning to meet essential services like the frontline health workers. So those tests are being developed, and there's an intensive effort underway to do that. I think there's an important quality control step when you develop antibody testing. That work is underway by our medical researchers and by our federal agencies that have to review and approve those tests. It took a decade for that to happen with the other epidemics, like the HIV epidemic. Now we're seeing things happening in weeks and months. So the pace of medical research and technological development is very fast. I know it's not fast enough for all of us who want to get out of our houses, but I'm amazed by the progress and the rapidity and the velocity that some of this stuff is happening in the COVID pandemic. The collaboration across research centers, both here in the United States and around the world, is unprecedented. There are open data portals, they're sharing research information, they're publishing pre-reports before they go through peer review even. And it's an amazing amount of collaboration that's underway to make progress on these critical issues. So please, others, please put forward your questions, and I'm ready to go to the next question now. Okay, a question from Beth in Pennsylvania. Beth is asking, I just saw on the news that they think Philly is one of the next hotspots. Do I agree? Since my county is right next to Philly, and we are one of the first counties in PA to be placed in quarantine, is there a worry that it could affect Montgomery County again? Beth, thank you for that question. And I have a lot of family, both in Philadelphia and in Montgomery County and Bucks County. So it's a question close to my heart. Yes, it does look like The Philadelphia Urban Center is looking like another hotspot, not surprising. We know that vulnerable populations in the city that are living in close contact, that many people there have underlying medical conditions. There are reports coming out from urban centers around the country that urban African American populations are seeing a very high infection and a high death rate, case fatality rate as well. And so the virus has been spreading in Philadelphia and in neighboring counties at the community level. You're right that Montgomery County was one of the first counties where the governor of Pennsylvania implemented restrictive orders for sheltering in home. I think it's really important right now, this week, next week, through the course of April, probably into May, to continue that rigorous sheltering in home in that area so that you can reduce the community transmission and reduce the number of people that get very sick. I've heard reports that some of the nursing home facilities in Pennsylvania, in Montgomery County, are starting to see cases of COVID. That's a danger sign or a warning sign that the virus is still spreading at the community level there. I hope that you and your family are working with your religious communities and encouraging everyone to avoid gatherings over the Easter holiday. I think it's a really important sacrifice that we have to make in order to protect ourselves and our community. I don't think we're out of the woods yet in Montgomery County, Pennsylvania, nor where I live here in Montgomery County, Maryland. I think this next few weeks, if we can hold tight and keep our shelter in home in place as much as possible, then we'll actually more successfully interrupt transmission. And we'll keep that wave of very sick people to a minimum so you won't overwhelm your hospitals and your health workers, like what we're seeing in North Jersey and New York. I think it's possible, because Montgomery County, Pennsylvania has been so proactive, that the peak will be flattened and that the number of very sick people won't exceed the capacity of your county. I will refer you to a website called COVID Act Now and .org, and if my support team can put that up in the chat, and you can put the name of your county. Your county has 831,000 residents. This model is showing a peak in Montgomery County in early June, and the hospitals could become overloaded in the next 4 to 8 weeks, according to this model. So again, there are different models out there. The state of Pennsylvania is working on this very carefully. Bucks County is also identified on this map as a hotspot, Montgomery County as well. So, and that whole part of southeastern Pennsylvania, according to these models, are places where there's going to be a lot of cases, and it's going to be critical to extend the social distancing and physical distancing. Okay, I'm going to move on to the next question now. Thanks, everyone. Okay, Kathy is asking, what do I think of the drugs, the hydroxychloroquine or Proquenil and the Z-Pak? So thanks, Kathy. We've heard a lot about this combination of drugs from our White House Coronavirus Task Force. And what I can tell you is that the early indications are that it may be working. And I can tell you that there are clinical trials that are underway right now. The only way to know is to do a clinical trial. You can hear one story here that it worked. You can hear another story here that it didn't work. You can hear a story here where someone died from taking chloroquine. So you're hearing a wide range of anecdotal stories, and that's where medical science has developed a very clear pathway to determine the efficacy and safety of drugs in this situation. So I'm happy to let you know that there are clinical trials that are underway in New York City and in different parts of the country, testing to see whether hydroxychloroquine and the Z-Pak are beneficial. And I believe in science, and I believe in data, and I believe that this drug is being used. What I've heard anecdotally from physicians is that using it early onset of respiratory distress when you have shortness of breath may be an indication that these drugs may be most effective at that point. Once people are already going into severe respiratory distress, or what's called acute respiratory distress syndrome, the ARDS, when they have a collapse of their vital organs, that these drugs are not as effective at that point in the process. Again, that's just what I'm hearing through physician contacts, and all the physicians are waiting for the results of the clinical research trial. Those trials are going on here in the US, but they're also going on globally. So we're learning a lot. There are over 300 clinical trials for a wide range of drugs. There are anti-Ebola drugs that are being studied. There are antiviral drugs that have been used for HIV that are being studied to see if they're effective against COVID-19. There are nutritional supplements that are being recommended, like vitamin D, vitamin C, zinc, which may be beneficial for people to strengthen their immune system. Those vitamins, vitamin D, vitamin C, and zinc, have also been shown to be beneficial with other viral illnesses and in terms of strengthening your immune system. If you have specific questions about that for yourself, please contact your doctor and ask for their advice about whether or not you should be upping your dose for vitamin D, vitamin C, and zinc. I think I'm taking all those vitamins right now at the recommendation of my physicians. So I do think it's valuable to explore what would be appropriate for you in terms of strengthening your immune system. Okay, great. The next question coming in from Rebecca is, what may be the answer to calm the wave of grocery, supermarket, and other public workers who have seen an uptick in their deaths? Thanks, Rebecca. We have seen those reports. I think that, as you know, on each of our calls, we express our great gratitude to our frontline health workers, the EMTs, the emergency medical technicians, the nurses, the doctors in the ER and the ICUs that are handling all these COVID patients. And we've also been expressing our gratitude to our pharmacy and grocery store workers. They are at the front line. They are keeping those essential services open. So I think what I've seen happening, which I think is a positive thing, is that social distancing is now being implemented more rigorously during those shopping experiences, where you have to ensure that you're 6 feet away from other people that are shopping and from the workers. Now, it does break down a little bit when you're actually going to pay, and so I think that's a challenge that we still have to figure out. And the other thing that you can do is start wearing a mask when you go shopping. That is also to protect yourself and to protect those other workers. And the rigorous hand washing before, during, and after shopping. So I always am cleaning my hands before I go out. I carry the Purell in a little bottle with me, so while I'm shopping and touching things, I'm using the hand wash. And then certainly when I get back home and re-enter my home, I'm using the hand washing rigorously in that situation as well. So I think that we've heard clear guidance from public health officials at the federal level and state level saying during this week, next week, while the epidemic is starting to increase its velocity, when the transmission is so vibrant right now, then the best solution is to reduce the amount of times that you go out shopping to the grocery store or to the pharmacy. So don't go every day. Go every week, every other week, or go every 3 weeks, or go no more than once a week. Try to reduce the amount of times that you're going out and interacting. Every reduction in physical contact social interrupt the transmission of the COVID-19 virus? Thank you for that question. Okay, so I think I'm caught up on your questions, but I want to make sure, so please, if you can add any more questions to the chat, that would be greatly appreciated at this time. I can't believe I've answered all your questions. While we're waiting for the next set of questions, I wanted to update you on some of the work that I'm doing with a coalition of organizations. As I mentioned to you, we have formed what's called the COVID-19 Emergency Response Group. This is made up of academic experts, public health experts, and civic groups, as well as former members of Congress and staffers, former mayors and local leaders. And we're working on developing a campaign and a movement of action focusing on protecting the people, testing the people, and treating the people. We have set up a Facebook page. It's the COVID-19 Emergency Response Group. If you could put that up in the chat so if people want to track that more carefully. We are working on a set of recommendations for the U.S. COVID-19 response, and we're going to try to get this passed into the next stimulus package that's coming up in this month. So we've already seen 3 packages of investment, and we're working on the 4th one right now, and we're calling it the People's COVID-19 New Deal. So while there's been action taken by the federal government, we're still seeing major gaps. We're seeing gaps in food. Many people are suffering from food shortages. We're seeing long lines around the country for people needing food. And we're working on solutions to extend the SNAP program. We're working on solutions around preventing eviction from houses and apartments, and expanding rental assistance. We're working on expanding and extending healthcare for all, and ensuring that people aren't strapped with heavy bills or medical debt from the COVID-19 pandemic and other causes. We're working on setting up this national surveillance system, getting it established in law and getting funded. We're also working on mental health and supporting expanded mental health services that are being stretched to the limit right now. And finally, we're looking at this both from the U.S. perspective and from the global perspective. So we're soliciting ideas right now from around the community of actors and stakeholders that are seeking bolder, faster action in support of the COVID response. And if you go onto our Facebook page, there's a form that you can fill out where you can put forward your legislative ideas. We're compiling that, and over the next couple of days, we're going to be sharing that information about that agenda that we're going to be advancing for a COVID-19 New Deal for the people. So that's an exciting set of work that's underway. I'm very excited. I've been working with experts from Rutgers University, from George Mason University, from Columbia University. So academic leaders are stepping forward. Duke University is submitting ideas. Advocacy groups across the political spectrum are mobilizing. And there's a lot of work that needs to be done to protect the people from the COVID-19, to provide a justice-based social protection support so that people aren't thrown out of their homes, they aren't left hungry, they aren't left without health care. We need to treat people compassionately and equitably. And also ensure that testing is available quickly across the country so we can move forward and prepare for the next wave. And also that antibody testing that I mentioned. And then treatment, rapid development of the therapeutic agents that are needed to reduce the impact of the illness, and of course the work that's going on around creating a vaccine. That work needs to be accelerated and intensified. So I'm excited about the progress that we're making with the COVID-19 Emergency Response Group. I've also been connecting and collaborating with local response groups. For example, there's a New York City COVID-19 response group that are working on the issues that are directly happening in their city. They're working on the prison crisis. There are prisoners throughout New York City and around the country that are now being infected with COVID, and they're trying to manage that and decarcerate whenever possible, and also make sure that those people get services. Is another group in North Carolina that's working on, that's established a COVID-19 response group. So we're working with them. And so we're working more at the federal level and the global level, and we're trying to support these local groups that are popping up around the country. So if you're part of a local group, please contact me and let me know how we can connect and support your local efforts, and take your ideas about what the frontline gaps are so that we can translate that into policy and action through the Congress, which, they have passed 3 emergency bills in the past several weeks, and a 4th one is likely, and a 5th one is likely in the weeks ahead. So we really are working hard to make sure that they are the most effective vehicles that we can get them to do. We're going to have to put pressure on them, as we know. Okay, great. Another question coming in from Karen. Her question is, she watched Chris Cuomo doing his show last night, and he himself is infected with the virus. She can't believe he's still working, and would he heal faster if he stayed in bed and rested? Yeah, so I mean, I only saw a few minutes of him. I actually thought he was looking a little better last night than he had been looking prior. He obviously has a mild case of COVID-19. I wouldn't even classify him as having a moderate case. People that are having moderate or severe cases would not be able to sit on TV for an hour and conduct a show the way he has. Now, I'm not minimizing his symptoms. He certainly has had fevers and muscle aches and other kinds of signs that he's talked about, but he seems like he's on the mend, and that's his personal choice. As long as he's isolating himself, which he seems to be doing from his family, so that they're not getting infected by him, or he's not going out into the community while he's recovering, I think it's up to him to determine his own course. I can't speak for that more than that. Okay, more questions are coming in. Thank you. So what is the peak date in Philadelphia, as they are closing 2 test sites Friday due to funding? Well, that's very disappointing to hear, that they're closing down testing sites at the point where we actually need to rapidly expand testing. If we don't test people that are showing signs, we don't actually know what the state of the epidemic is. So there are 2 different models that are publicly available right now. I talked about the one, covidactnow.org, that is available. You can check that out. Philadelphia, it's done by county. So Philadelphia County, according to the COVID Act Now model, isn't expected to peak until early June. So they're at the early upswing in all these different scenarios. So I think it's a mistake to start closing testing sites in the Philadelphia area or in Pennsylvania at this point. If there is a shortage of money, I think then advocacy is needed from people in that area to call on the state legislature and the federal government to provide emergency funding, not only to keep existing testing sites up and running, but to expand them. Please send me that information. I'd like to pass that on to other folks in the government that can help take action on that. The funding could come from different places. The county government has funding to support testing sites. The state government has funding for testing, and the federal government is the third source of funding. So I would this is a great opportunity for people in your network to take action to ensure that testing is expanded rather than contracted, as your area is still seeing community-wide transmission, and it's very important to keep testing as much as possible. Okay, great. Thanks for that question. All right, folks, we have time for a few more questions. There we go. I see a couple more coming in now. Thank you, Rosemary from Virginia. Is your effort a good match for working together with my colleagues working and lobbying on Older Americans Act, needing funding to meet the needs of older Americans during this pandemic? Absolutely, Rosemary. I will send you the form to capture your legislative ideas for older Americans. I've been working with the Gray Panthers. Jack Kupperman, who's been on this call before, he's set up an older American support response in the New York City area, where there's a lot of single elderly people living alone. So there are these kind of programs being set up in many of the hotspots. There's also a lot of people living in assisted living or nursing home facilities that are sheltering in their rooms, that need social connection, need people to reach out to them. And of course, yes, if there are legislative ideas that you have that you want to see in the next stimulus, please, we would love to include those and love to connect with your colleagues that are working on the Older American Act. There are existing bills that are pending before Congress that could be built into the Stimulus Act, the stimulus funding, and there might be special needs or urgent needs that are emerging that haven't been met yet through the action thus far. So, for example, if Pennsylvania is closing down testing sites at a time when their epidemic is increasing with great velocity, that doesn't make any sense, and we need to take action to make sure that those testing sites are expanded. I would be recommending bold and aggressive action in those situations. Okay. All right, well, thanks everyone. I'm going to give it one more minute. If there are no more questions, we're going to wrap up the call today. And we'll wrap up the call today with a moment of gratitude. First of all, I want to express my gratitude to all of you for your participation in these live chats and for your great questions, for staying engaged, for doing everything you can to stay safe and healthy, for protecting your families and your community. I know it's hard and difficult. We've been in this kind of shelter-in-home situation for over a month now, many of us. It's hard. It's really tough. So thanks for being part of this community of people that are compassionate and caring and working hard to control the epidemic. But I also want to extend our gratitude to those frontline workers, the healthcare workers, the emergency medical technicians, the healthcare workers, doctors and nurses, and also the janitors and the food staff and all the support staff in the hospitals that are managing this surge of cases. I want to express our gratitude to the Army Corps of Engineers and all those workers that are building new hospitals and convention centers on fields, in the cathedral in New York now. It's unbelievable. So all of those workers that are doing that amazing work, we thank them and we express our gratitude. All the workers in the government at the FDA, the CDC, the NIH, the research officers, the public health officials, even the folks on the coronavirus task force who are working night and day to try to course correct from our response that was very slow and failing, and trying to get stuff done now so we can get ahead of the curve here. So let's just express our gratitude to all those people in a moment of solidarity. We humans are amazing when we set our minds and our hearts and our souls to taking action and saving lives. And I'm excited about the progress that's underway. I'm scared about the failure of our response so far, but I'm excited that we're working together now to get bold action to happen. Thank you, everyone, and thanks for joining. I'll be back on Friday at 3 p.m. Eastern Daylight Time for my third live chat this week. I appreciate all your participation. I will be on Chicago TV tomorrow morning, answering questions through a station out there in Chicago. So thank you to you for helping me get ready for that opportunity that's coming up tomorrow. Thanks, everyone. Have a great day, and we'll see you again on Friday. Peace. Peace and love to all of you.